I'm Dr. Sewanti Limaye. I'm the Director of Medical and Precision Oncology and Oncology Research at Sir H N Reliance Foundation Hospital in Mumbai, India. I'm here today on behalf of the easiest exam. The easiest exam is a breast cancer initiative. It's essentially to enhance breast cancer awareness, breast cancer prevention, and enhance the knowledge of breast cancer treatments. The easiest exam is going to be a website where you can find additional details of the easiest examination that is available today for breast cancer prevention, and that is breast self-examination. Please look out for this initiative, please look out for this website, gain additional knowledge of what should be done to best prevent your breast cancer, and that is a monthly breast self-examination by the women of the nation and abroad. When we talk about breast cancer treatments, there are three types of breast cancers at large. There's hormone positive breast cancer, there's HER2 positive breast cancer, and there's triple negative breast cancer. A very small proportion of breast cancers are of a fourth kind, which is triple positive breast cancer, where there will be hormone positive as well as HER2 positive. HER2 positive breast cancer gets treated with targeted therapy. The targeted therapy is called trastuzumab. Many other treatments have come in to target the HER2 receptor. Different versions of trastuzumab, enhanced versions of trastuzumab have also come in, like trastuzumab deruxtecan, trastuzumab emtansine. All these are called antibody drug conjugates, and they enhance the efficacy of directive treatment to HER2 receptor. There's another molecule called pertuzumab. All these molecules help target the HER2 receptor and control the progression of disease through this pathway, the HER2 pathway, and improve outcomes of management of HER2 positive breast cancer. So HER2 directed therapy or targeted therapy for the HER2 pathway can be utilized in early breast cancers that are HER2 positive as well as advanced breast cancers that are HER2 positive. And these treatments have been transformative and brought about paradigm shift in the management of breast cancer over the last couple of decades, and really enhanced outcomes in increasing progression-free as well as overall survival. Giving HER2-directed therapy is imperative in HER2 positive breast cancer. HER2 is a dominant gene, it's a dominant pathway, and if you don't address HER2 by HER2-directed therapy, the outcomes are going to be inferior. Always look out for whether your tumor is HER2 positive or not. Certain types of breast cancers are also managed with the help of immunotherapy. Immunotherapy is another modality that has helped transform the outcomes for all different kinds of cancers, many different kinds of cancers, including breast cancer. Triple negative breast cancer could respond to immunotherapy. So if you have triple negative breast cancer, please reach out to your oncologist and check with them if you are a candidate to receive immunotherapy. Certain types of triple negative breast cancer may not respond to immunotherapy. But if this is early breast cancer diagnosed at an early stage, we don't need to test for any biomarkers. Any triple negative breast cancer patient may be a candidate to receive immunotherapy if they have early stage disease. In advanced stages, biomarker identification is critical. The patient needs to be PD-L1 positive, and then they are a candidate for immunotherapy if they have triple negative breast cancer that is of advanced stage. Immunotherapy is a modality that enhances body's own immune system to attack cancer. Triple negative breast cancer is considered immunogenic. It activates T cells. It attracts T cells to engulf the cancer. And when we have an immunotherapy drug given to the patient, it can enhance the T cell coming together with the tumor cell and engulfing the tumor cell, eating up the tumor cells, and leading to a higher response than just chemotherapy. Today, breast cancer management is way beyond just chemotherapy. You have to look out for what the biomarker is telling you, which biomarker is being expressed. If it is going to respond to targeted therapy, it's going to respond to immunotherapy. And so, if someone has triple negative breast cancer, they absolutely should be asking the masses, the doctors, whether they are a candidate for immunotherapy. Breast cancer management has gone from just hormonal therapy and just chemotherapy to all kinds of targeted therapy to immunotherapy. When we give targeted therapy or immunotherapy, these modalities of treatments are actually quality of life preserving. So the quality of life of a hormone positive advanced breast cancer patient today is completely different from where it used to be a decade ago. Why? Because if a patient is hormone positive advanced breast cancer, they may actually be treated with a targeted therapy pill and a hormone therapy pill, and they may not need anything intravenous. They may not need any chemotherapy, even though they have advanced breast cancer, metastatic breast cancer that has spread. So I always say this, biomarker identification is most critical. You need to know which type of breast cancer you have, whether this is going to be addressed with hormone, and if hormone, then hormone plus targeted therapy, both in form of pills. No IV chemotherapy may be required. We have someone who has HER2 positive breast cancer. It's HER2 directed therapy, and HER2 directed therapy, targeted therapy is again very easy to tolerate, much less toxicity than chemotherapy, quality of life preserving. If someone has triple negative breast cancer, they may be candidates for immunotherapy. Immunotherapy, my general verdict is that 95 out of 100 will not have any significant toxicity. 5% that can have significant toxicity should be monitored very carefully. And again, quality of life preserving. So when we look at different kinds of breast cancer, first we need to be biomarker aware. Let's all come together to raise breast cancer awareness, to prevent breast cancer, and to improve outcomes by treating early. Check out the website www.easiestexam.com. This is the initiative. The simplest, the easiest exam for early detection of breast cancer is breast self-examination by the women of the nation. Let's all come together in raising breast cancer awareness. Early detection saves lives. Easiest exam it is. Thank you for having me.